I'd like to ask you, what populations are most at risk of being left behind during AI adoption globally?
Thank you, Jason. I was thinking about a term here is technological colonization. When
Mhm.
AI systems are being built in wealthy countries or getting deployed into communities like indigenous people, rural areas, low income. As a Brazilian, I really know that this is happening, and marginalized groups without their participation or any leadership. So, my concern as someone that is in an intersection of two different worlds, right, is most of the AI is trained on data from rich healthcare systems. Even in Brazil, the major EHRs that we have and they develop inside Brazil, like with Brazilian analysts and engineers, they have been training their EHRs with North America data, with United States and Europe data. So this is a major concern. And as a nurse, I see this firsthand. We are closest to patients and communities. I have been treating low income communities in Brazil, and I know that we work with fewest resources. We know exactly where AI helps and where it fails. So when I see that we lack of representation in the data, transparency in the algorithms, and our voice and design is not a joke. And you were talking about this, like Kenya, like population. Where are studies that prove that the AI implementations are appropriate for this population? Women, children, minorities, right? And so I have a few suggestions what needs to change globally, and it's a dream, I know, right? But we need to talk about this. Decentralize AI development, fund regional hubs in Africa, South Asia, Latin America, train and validate algorithms on local data, local populations. This isn't charity. It's building the evidence base that should have existed all along. We have been talking about how long AI is around. We know that the boom was when, like you said, Jason, when ChatGPT came to the world, but we have been training systems with data that are so limited. When it comes to limited, my terminology brings like wealthy people. And even like epidemiologists in an epidemiologist way, the diseases are managed in North America are completely different from the ones that are managed in South Africa and Brazil. So transparency standards, international bodies must mandate algorithm audits, bias testing, performance data broken down by population. And I'm talking about this so energetically because it really hurts me seeing those model being is adopted in Brazil, for example, and people not knowing that they have bias in front of them, that they have hallucinations in front of them. So it really it's urgent for us to take some action, and that's why I decided to join this amazing alliance, and I'm really proud of it because this is one of our major missions here: building relationships that aren't extractive, push back against technology flowing north to south without shared data, governance, or real benefit.
Oh, that was great. And I think you highlighted a real point, right? Or at least that's what struck with me is that bias, you're obviously you're not aware of it. I mean, that's the point,
Exactly.
right? Like that's literally the
Right.
point. Like,
Right.
so
Right.
you can't just take from I'll just use the United States because that's where a lot of these models are being developed, US and China, um, and apply it to Kenya. I mean, it doesn't flow. And, that's pretty obvious on its face, but having that transparency, data cards, audit by like those processes, which are being addressed at some level on the regulatory side, um, we need to see that standard implemented globally. And there's from an attorney perspective, there's some of that, right? A little bit, but we have a long way to go for sure.
Yeah,
Yeah,
for
nicely
sure.
done. Nicely done.
Thank you.
Um, Dr. Lorrie Davis-Dick, what mental health and emotional risks should healthcare leaders consider during rapid AI implementation?
And thank you for your question. I think it's a great segue into our just the recent just passionate conversation, and just like I think all of our presenters, um, my focus in my area of nursing is mental health, and I'm with some national organizations that focus on the well-being of not only nurses but also doctors, and the ultimate goal to prevent burnout. In addition to that, to try to prevent suicide as well. And so there, I think, are some deeper layers that we have to start to think about as AI is starting to transform nursing specifically. We know that the ANA has put out their statement, saying that AI must have guardrails, and they're nurse-led guardrails. In addition to that, that we must ensure that AI is ethical, that the nurses receive optimal training and education to be able to approach and use and not replace their current knowledge, so that this particular opportunity to improve healthcare can be used to the fullest extent. I think that the risk of kind of introducing that rapid influx of AI models to an already very challenged, very, I think, congested profession, I think emotionally, is something that we kind of have to stop and pause. And I don't know if hospitals or health organizations have really looked at that. The poor implementation of AI and doing that so quickly to try to scale, and I want to do this better than and faster than the other hospital in my state. Is not putting the nurse first, is not putting the patient first, and ultimately goes back to that conversation of, are we actually starting to add more burnout, to the nurses and to the health system?
Mhm.
The psychological impact, and that shift of introducing new technology to an already pressured workforce definitely can leave, nurses and other healthcare providers just feeling like their workload is just even more heavy. There's just kind of really not any room to breathe, so to speak. Clinicians also can experience kind of more of that brain fry, and not they're already experiencing that now, and so to kind of add to that experience, it continues to kind of mitigate as a negative experience for the clinician. Kind of having a rapid implementation or increase in speed of a new AI model into a health system does not necessarily mean that nurses are going to align, and trying to throwing out training that's just kind of very fragmented or very quick, ultimately is going to impact the quality of the patient care, but also it's going to impact the quality of the implementation and the nurses' well-being. Um, I think we should continue to take into consideration the human factor, and where is nursing globally? Where do we stand? What is causing that workforce depletion? And if we want AI to basically enhance and augment and try to help support our overall patient goals, we need to kind of have nursing again at the table, but also have organizations like the American Nurses Association be a part of and be a member of understanding how are you going to help nursing kind of guide this path, because I think right now it seems to be pretty fragmented, and I'm also very grateful to be a part of this organization, because I do see it as the hub. I do see it as the intersection and the core of where healthcare organizations, hospitals will come, nurses will come. And from my background and currently as a nursing professor, we should be coming to organizations like this saying, you're the starting point. We need a starting point. We need guardrails, and we need to protect that cognitive burden that we know. And I know my nursing students are going to already come out experiencing that. And how can we start to kind of elevate our own knowledge and our own skills, to help nursing students understand, if the health system is kind of introducing some new AI tools pretty rapidly, is this really the health system you should go to? So the conversations are going to shift, and the psychological impact is going to be a factor. And this new generation of nurses, they're trying to protect their mental health. It's not like 20, 30 years ago. This is a priority. And so I think there's kind of that pebble effect that we must take into consideration.
I agree. And I think you're 100% right. My wife is a nurse, so near and dear to my heart for sure. And I think you're right. The conversations are beginning to shift, and this is what we're doing right now. So thank you very much. I'd like